Welcome to Maxi Life Wellness Fridays featuring Preventing Colon Cancer, What You Need to Know. I'm Patricia Bermudez. He's on your host for this event. Today's session is very important, not only to those who are thinking they might have the symptoms already, but to everyone, so that all of us can lower the risk and prevent colon cancer. According to the Department of Health, it ranks 6th overall in incidence and mortality. Just like any other disease, early detection gives it a higher chance of treatment. March happens to be the Colorectal Cancer Awareness Month. So this discussion comes at the perfect time and is really significant for all of us. At this point, I'd like to introduce to you our speaker. He is the incumbent treasurer of the Hepatology Society of the Philippines and an active consultant of the Makati Medical Center, the Medical City South Luzon, and Asian Hospital and Medical Center. He is also a medical resource specialist of Maxicare Health Management Organization. Here to lead the discussion on preventing colon cancer, what you need to know, let us all welcome Dr. Angelo B. Lozada.
Hi, good afternoon, Pat.
Hi, Dr. Angelo.
Can you hear me?
I can hear you.
Okay, so we'll start our discussion for today. Let me just share my slides.
Go ahead. We're looking forward to it. Thank you so much in advance, Dr. Lozada.
Okay. Okay, here we go. Okay, so good afternoon, everyone. Welcome to Maxicare's Wellness Fridays. I hope everybody is safe and everyone is healthy. And most of you are probably just at home, just like myself. And today will be a different topic. It's very special to me because this is probably one of the advocacies that I'm very concerned about in regarding gastrointestinal health, which is colon cancer. So today I will give you some tips on how to prevent colon cancer and also be able to have more awareness about it. So what does the Queen Elizabeth mother, Corazon Aquino, Ronald Reagan, Chadwick Boseman, and Will Dasovich all have in common? What do they have in common? They all were diagnosed to have colon cancer. And 4 out of the 5 people in this picture have already passed due to colon cancer, except for Will Dasovich, who survived it. But this does not mean that colon cancer is not survivable. So I'll explain that later in the next few slides. So colon cancer is actually the 3rd most deadliest type of cancer. And it is actually the 4th most commonly diagnosed cancer worldwide. So collectively, colorectal cancer is the 3rd most common globally, which comprise around 11% of all cancers worldwide, according to the Globocon 2018 survey. And over 2 million are diagnosed yearly just in 2018, and more than half of them actually die. And there's a high mortality rate in colon cancer because usually these are diagnosed late or they're catched late. First of all, what is the colon? So I'll just go briefly into what the digestive system is, particularly the colon. The colon is also known as your large intestine or your large bowel. It is around 150 centimeters long, and it approximately around 5 feet. So your stool has to pass through 5 feet of intestine, of large colon, and the stool, as it passes through the colon, the water is absorbed, and the main function actually of your large intestine is to process waste. So the body that produces waste is processed in the colon, and it is solidified in your colon. So as it passes through the different parts of the colon, water is absorbed until it becomes solid when it is evacuated. Again, so what is colon cancer? Colon cancer is when there is abnormal growth in the lining of your colon, and this grows inward, not outward. So the cancer really starts from inside, and this grows progressively until it can invade the deeper structures of your colon. So usually they start off as polyps, and these are usually harmless. No, there are different types of polyps. There are adenomatous polyps, which are what we call precancerous types of polyps, and these types of polyps have malignant potential. But there are also certain types of polyps that are not malignant, or which we call benign polyps. So what are the factors that you cannot control? No? Number one is your age. No? So as a person ages, the tendency to grow or to develop these polyps also increases. So usually we see these polyps that start to grow when you're around 50 or more. So by the time you're 50 years old, the chances of seeing polyps in the colon are actually higher. Another are people who have inflammatory bowel disease. So this is a gastrointestinal condition where there is persistent inflammation of the colon or the other parts of the intestines. And this predisposes one to develop and have a higher risk for developing colon cancer. Next is your genetics. So if you have a family history of colon cancer, especially a first degree relative with colon cancer, then you are automatically at risk. So you're automatically high risk. So what are the factors that you can control? Number one is eating a lot of, you prevent eating a lot of red meat, processed foods, uh, yeah, controlling your weight. So I see that most of you have mentioned that you are obese, that you feel like you're obese. So that is actually a risk factor for developing colon cancer, as well as other cancers. Not exercising enough, of course, having vices such as smoking and heavy alcohol intake. Symptoms. So, doc, are there any symptoms or warning signs that we can see? Mostly none. So there are few red flags, but I'll tell you about that later. But it's important. It's really important to get yourself checked, because when you find it early, it becomes more curable. Usually, colon cancer does not present with any symptoms unless it's too late. So when it's too late, when you start experiencing symptoms such as weight loss or blood in the stool and all of those things, then the cancer might already be there, or it could be already on a late stage. So if there's something that you guys should remember out of this talk, is these 5 red flags that you should know about colon cancer. So number one is family history. So if you have a first degree relative who has colon cancer, like a mother or a parent or a sibling, then automatically you become high risk yourself. Initially, the recommendation is to screen 10 years earlier than the age that person was diagnosed. So for example, if you have a sibling that was diagnosed at around 30 years old and you're only 20 years old, then you should get a screening colonoscopy 10 years earlier than your sibling or your brother. Next is blood in the stool. So any type of blood in the stool is a warning sign. No, so but it depends. There are lots of differentials for having blood in the stool. It could be just as benign as hemorrhoids, or could be as serious as colon cancer or bleeding polyps. Next is unexplained weight loss. So I know maybe most of you would say you have weight gain rather than weight loss, but those who experience weight loss, this is one of the signs that there is probably cancer developing inside the body that is causing the weight loss. Next is your changes in bowel movement. So if there is a sudden change in your bowel movement, like diarrhea or constipation, or any change that you notice that is out of the ordinary, then that is actually a red flag to watch out for. Next is also anemia when you have blood loss. Anemia would mean that your hemoglobin taken from a CBC count would actually be very low. So unexplained anemia would be another warning sign of possible malignancy or cancer. So how do you get tested? No, how to get tested? Actually, getting a colonoscopy or getting yourself tested or screened is just like preventive maintenance. The recommendation actually is that the new recommendation now, it used to be at around 50, with or without any symptoms, you should get yourself checked. So now they lowered it down. The US Preventive Services Task Force and the American Cancer Society actually recommended a lower age, which is 45, which so that we will um, be able to screen all of those individuals that might start to develop these polyps. So screening is actually key to an early diagnosis and early prevention. So how do you do it? Um, the gold standard would actually be doing a colonoscopy. So getting a colonoscopy at the age of 45, even if you don't have symptoms, even if you don't have a family history, even if you don't have those warning signs, just getting a colonoscopy at 45 years old is just like your preventive maintenance, bringing your car to the casa and having it checked because you want to prevent breakdown in the future. So I'd like to show you some pictures of myself. This is at Makati Med. No, we are performing endoscopies and colonoscopies there. Uh, Despite the pandemic, we've taken extra precautions to make sure that everyone is safe, and the procedure is actually painless, and it's very quick. No, it usually just takes around 30 minutes. So this is a sample of this is a picture of how it looks like. Other tests. So for other people who are a bit, scared, or they don't, they feel like they don't want to go do a colonoscopy, you can do other tests. No, one is a virtual colonoscopy. So a virtual colonoscopy is practically like a radiologic test where we do a scan of your colon, and but with the virtual colonoscopy, this is non-invasive. When we find polyps or we find anything in the colon, then the recommendation would still be doing a real colonoscopy afterwards. And small polyps may actually be missed during this particular procedure. Other tests that could be done would be your fecal occult blood test. So this checks for microscopic blood in your stool. So because cancer or polyps that are large tend to have they outgrow their vascular structure, so they tend to bleed. So they can you can release blood into your stool, and this is occult, meaning it cannot be seen by the naked eye, but it can be seen under a laboratory examination or under a microscope. So this test can actually be done as well as a screening tool. So it should actually be diagnosed right. So when your doctor does a colonoscopy, the next thing is that the samples are taken. So you can see here, during a colonoscopy, we can snare that polyp or remove that polyp and send it to the lab for analysis. And under a microscope, this tissue sample is examined, and a magnified view can be seen of the cancer cells. Another thing that is commonly asked is the stages of colon cancers. Like, Doc, ano ba yung mga stage? Like, how will it affect me? So it really depends on when it's caught. No, so if it's caught early, like stage 0 or stage 1, it means there's a better prognosis. But as the stage progresses, no, meaning the tumor invades more structures, and of course, stage 4 would mean that the tumor has spread to other organs of the body outside of the colon. Then it confers a poorer prognosis. So this is how we actually stage colon cancer. Your doctor might actually say your doctor might actually give you like a five year survival rate. So what does that mean? It's just a statistic showing that how many people would survive in 5 years when they're diagnosed on a particular stage. For example, so we can see here that the overall survival of colon cancer, when taken all together, is around 75%. Those who were diagnosed to have stage 1 cancer, colon cancer, would have a 5-year survival rate of about 87 to 92%. But these numbers only predict chances of survival. There are other factors that may influence the survival of a patient who is diagnosed with colon cancer. So this cannot actually predict what would happen for each and every individual. What are the other things that may be done if you're diagnosed with colon cancer? One can end up with surgery, wherein the particular section of a diseased colon is removed, and they may be put back together. Another is that chemotherapy, a combination of chemotherapy or radiotherapy, may actually also be recommended depending on the stage of your colon cancer. So all of these are actually very individualized. So these are some of the things that your doctor would recommend to you on what is the appropriate type of treatment based on your symptoms as well as the stage of your colon cancer. So what can you do to prevent colon cancer? So the things that you can actually do is control your weight, control obesity, eat healthy, have a good balanced diet, rich in fiber, rich in fruits and vegetables, low on the processed meats, and substitute whole grains for processed grains, and also have great physical activity. The American Cancer Society has actually mentioned in some studies that 24% of active people have a lesser chance of there's a 24% chance of lesser chance of developing colon cancer compared to those who are sedentary. So what the magic number would be to have at least 150 minutes of exercise in a week's time. So that would roughly be around 30 minutes a day of exercise. It doesn't have to be it can be work or play type of exercise. So that's 30 minutes a day for 5 times a week, or 75 minutes of vigorous activity for the entire week. So you don't have to do it all 75 minutes at one time or 150 minutes at one time. You can spread it out throughout the week. Also, it's very important to quit smoking, stop smoking, as well as um, drink in moderation, especially now that it is COVID times. So there is what we call a COVID-19 hangover, where most people just stay at home and drink a lot of alcohol. So that's my last slide. So the I would just like to share to everyone that colon cancer is preventable, it's treatable, and especially it's very beatable. So with that, I would give the floor back to Ma'am Pat, because I'm sure there will be a lot of questions from the audience today.
Absolutely, Doc Jello. Thank you so much for all that information. I actually learned a lot. I was sharing with Doc Jello that I too have had family members who have gone through this, who have or had it. So this is really very interesting to me. But of course, it's something that obviously is very interesting also to a lot of people here, because we're bombarded with questions. But right now, we will be introducing all of you to another expert who will facilitate the Q&A for us. Our moderator is actually a board director of the Hepatology Society of the Philippines, a gastroenterologist and hepatologist, and an active consultant at the Makati Medical Center, Protasio Hospital, and UniHealth Parañaque Hospital. Let's all welcome Dr. Suzette Grace Koherman. Hi, Doc Susie.
Hi, Patricia. Thank you for that kind introduction. And I just want to say thank you, Dr. Lozada, for that very comprehensive lecture about colon cancer. So I know we have a lot of participants tonight, and I see there's lots of questions on our Q&A box. So without further ado, I'll just start asking the questions for Dr. Jello. So firstly, most people say that screening starts at 50 years old, but sometimes we hear, several doctors saying that 45 years old is the screening age. So when do we really start screening for colon cancer?
Hi, Susie. Nice to see
Hello.
you. So, thank you for that question. So, actually, it was just recently updated by the American Task Force and the American Cancer Society that they've actually recommended lowering down the age to 45, so as to prevent to prevent and to catch all of those patients that would start developing these polyps. Um, I guess this comes from the fact that the our population is changing. We're eating a lot of processed foods. We're eating a lot of junk food, for that matter, and obesity is very prevalent. So we are seeing cancers developing earlier, and lowering down the age would help us catch all of these and try to prevent them from developing complications.
So yeah, I actually agree with you. So I think there's no harm in screening for colon cancer earlier. At least if it's earlier, then it's negative. That's all right. Rather than missing a diagnosis. Okay, so we have another question. Is colon cancer common only among males? For example, I'm female. I'm not yet 45. I don't have any symptoms, or a female who's already actually 50 years old with no symptoms. Does that mean she has a lower chance of developing colon cancer?
Yes, thank you, Susie. Actually, age does not, well, age matters, but sex does not matter. So your gender does not matter. If you're a man or a woman, you have the same risk of developing colon cancer.
Okay. So I guess it's actually depending on also yeah, the family history, their diet, their lifestyle. Okay, so I have another question here. How do we differentiate bleeding from, just from a simple hemorrhoids versus a possible colon cancer?
Okay, that's a very good question, Susie. Usually hemorrhoids are, it depends. You have to actually be able to consult this with your doctor. I would advise you to see your gastroenterologist. Um, Also, it depends on the age. Now, for example, if you have a 20-something-year-old guy or girl with bleeding, then we would not really have a high suspicion of something that's more serious than just hemorrhoids. Also, sometimes hemorrhoids would present with pain or a lump in the anus. So those are some of the clues, and it would really help your doctor will really help you and guide you in decision making with regards to what are the next steps to take. But it's really also about assessing your risk. No, so if you know that you have a family history for colon cancer, if you have all of the other warning signs like weight loss, anemia, and changes in your bowel habits, then it would be time to see your gastroenterologist and probably do a colonoscopy depending on his or her recommendation.
Yes, so it's very important when you're not sure, you just better go see your gastroenterologist. Okay, so how about does all of the red flags have to appear altogether, or what if we only have just one symptom out of five?
Okay, that's a good question. You don't have to have all of the red flags. Just one red flag would actually, raise the awareness. Like, okay, something's wrong here, or something has to be checked, or
Mm-hmm.
something might be more serious than this.
Okay. So, yeah, thank you for answering those questions, Jello. So, there's another question here. Oh, it seems you have a lot of questions tonight. I think a lot of people are very interested in our topic. Okay, so if I'm age below 45, can I also get a colonoscopy, or do I have to be, 45 years old and above before I get a colonoscopy?
Yes. Well, the recommendation is to get it at 45.
Mm-hmm.
You can actually get a colonoscopy earlier. It That would be considered as an elective type of colonoscopy. Also, depending on your risk factors, or what you think your risks are. But of course, your doctor will give you will guide you through the process and give you reassurance if you actually need one, or if it could still wait. So you can get the colonoscopy at an earlier age. It's like, it's like, checking yourself for certain things. But
Mm-hmm.
once you hit 45, then that's the time that,
You really have,
even if you don't have symptoms, yeah,
yeah.
you should have it
It's,
checked.
it's really recommended.
Yes.
Okay, so I'm sure a lot of people are also questioned, especially for those who haven't undergone a colonoscopy yet. So how do you prepare for a colonoscopy? Is it painful, Jello? Because those are the usual common concerns from patients. They'll ask, Doc, masakit ba? Kasi tulog ba ako dyan? Gising ba ako? So how do you do the colonoscopy?
Yes. Okay. That's actually a very, I'm sure,
Yeah. How do they
you get
prepare
that,
for it?
question all the time as well. How does a patient prepare for it? Usually, your doctor would give you a specific type of diet a few days prior to your colonoscopy, and there are certain medications, some laxatives that would be given the night before. On the day of your colonoscopy, it is usually done sedated. So we usually give IV medications that would sedate you, that would put a person to sleep, but really not totally knocked out. Somewhat more of a twilight type of sedation. And this would ensure that your procedure would go pain-free and would go smoothly. It usually just takes around 30 minutes, depending on on how difficult it is to navigate through your colon. But on an average, it just takes around 30 minutes. It usually takes a little longer when we have to remove polyps, or we have to um, take out or get biopsy samples.
Okay, so I agree with Dr. Jello. So usually colonoscopy is just very fast unless the patient really has a lot of polyps that really have to remove. And Dr. Jello, so after a patient undergoes a colonoscopy, how often should they undergo colonoscopy? Do we have to do it? Do we have to do this yearly? Is it every 3 years? Every 10 years? What's
Okay.
your comment?
Okay. So once a patient comes out with a negative colonoscopy, meaning there are no findings, everything is normal, that is actually good for 10 years. So parang you would get a 10-year warranty uh, from that colonoscopy. So if you're 45, the next time you get another colonoscopy would be 55. Um, if we find polyps, and we see that these polyps are adenomatous or precancerous in nature, meaning they're not cancer, but they have the potential to become cancer, your doctor, we would recommend actually that you do your colonoscopy earlier. That your next colonoscopy would either be the year after, or after 3 years. So usually that's the case. So it depends on what we find, because once we get tissue samples of polyps, we send them to the lab and have them analyzed.
Okay, so the answer would be it depends on the biopsy result of the patient and if there's a polyp finding after the colonoscopy was done, right? Okay, so some questions here. Other questions would be: does having a gastroesophageal reflux disease or GERD increase the chance of having colon cancer?
Yes. Okay. I'm sure this is also a very popular topic.
Yeah,
GERD and
very
acid peptic
common.
disease, yeah, especially now in the time of the pandemic when everybody
Yes,
is so anxious, and
and everybody's
there's a
taking vitamin C.
yeah, there's a lot of stress. Everybody's taking vitamin C and zinc. Actually, that's a whole topic altogether. But to answer your question, Susie,
Mm-hmm.
there is actually no relation between having acid-related disorders,
Oh, okay.
or GERD, or acid or gastritis. There's no relation to the development of colon cancer. So, acid peptic disease or gastritis or GERD is actually an upper gastrointestinal disorder, while colon cancer is a lower gastrointestinal disorder. So They're two separate domains.
Okay. So another question here. Thank you for answering that question, Dr. Jella. So another question here is, how can we detect colon cancer at an early age, like in stage one or stage two? Will it be late already if the patient develops the symptoms prior to colonoscopy?
Usually, yes. What we do is, when we do the colonoscopy, we look at the tumor or the polyp, and we try to remove it, and we check the margins. If it is clean, the margins are clean, meaning we are able to remove the entire polyp or the entire cancer itself. No, but you can have cancers that are still small. So once we have that analyzed in the lab, they'll tell us if we were able to get very clean margins. Otherwise, if the margins are not clean, then the next step would probably do what we would do would be a CT scan, like to check other organs and to check for
Mm-hmm.
invasion as well. So by that, we might end up or might recommend doing surgery to remove that particular segment of the colon.
Okay. So thank you for that, Dr. Jella. So what are the foods? I know you mentioned it a while ago in your lecture, but for the benefit of our audience here, especially for those who have just logged in. So can you tell us again, what are the foods that we can avoid to cause colon cancer? Because right now we have several patients or people doing keto diet, so that to promote weight loss. For example, is doing keto diet like safe? What diet do you recommend?
Thank you, Dr. Susie, for that question. Actually, it's that the recommendation of the American Cancer Society would actually be to have a diet rich in fruits and vegetables, meaning
Mm-hmm.
high fiber diet. Also, less on the processed foods and processed meats,
Mm-hmm.
and substitute your processed grains for whole grains. So maybe having instead of having really polished and processed rice, having brown rice or red rice. Those are some of the things that small steps that you can take to lower your risk.
Yeah, and in addition to what Dr. Jello mentioned, because I saw here a question that they're doing keto diet and they're not allowed much fruits and vegetables. So keto diet can promote, weight loss, but in terms of, colon health, then I think it's not really advisable, because when
Mhm.
you do keto diet, you have a high intake of, fats, proteins, sometimes maybe processed food, which are not really healthy for our
Yeah, I
intestine.
agree. I agree. And you can't really do keto diet for a long time.
Yeah.
So it's not really advisable.
Okay. So another question here is, does colonoscopy have side effects? Like after colonoscopy or during colonoscopy, what are the expected symptoms or possible side effects that the patients can have?
Okay. Uh, as I've mentioned, the colonoscopy itself is painless and very quick. What we do, gastroenterologists, is that we insert a scope, as you've seen, into the colon, and we try to insufflate it with air. So some of that air actually stays inside the colon. So patients may actually feel a little bloated, but eventually you'll just pass it out. So that is probably the most that a patient may feel after the colonoscopy itself. That there's some retained air inside the colon, so they'll feel a little bloated, but eventually they'll just pass it out.
Okay. So is colonoscopy safe? For this time of a pandemic. So what are the, I guess, precautionary
Precautions.
measures? Yeah, that we do in the endoscopy unit, so that patients will feel secure, especially now that we have COVID on the rise.
Yes. So we at Makati Med, together with Dr. Suzy, we're still doing endoscopies. We're still doing colonoscopies for patients that actually need it, because healthcare has to continue.
Yes.
Not all patients have COVID. There are also a lot of other diseases that have to be checked, and we ensure that it's safe. So all of the patients who do endoscopies, and it is recommended that by the Philippine Society of Gastroenterology and the Philippine Society of Digestive Endoscopy, that all patients who would undergo any type of endoscopy are required to have an RT-PCR test, as well as practice the precautions, all the safety measures prior to doing the procedure.
Okay, so I'm sure that that will at least confirm the fears of our audience. And there's another question. So when we do colonoscopy for our patients, is it as an outpatient? Do they have to get admitted, Dr. Jello?
Uh, okay, so generally, colonoscopy and endoscopy is actually an outpatient procedure. It's just a day procedure, uh, unless there are certain indications to have yourself admitted. For example, uh, if we have a patient who's very frail, uh, a patient that would require additional clearances from other services like cardiology or pulmonology, those types of patients have to be admitted. But on a regular basis, like your regular person or your regular Joe, you only do your procedures as an outpatient basis.
Yeah, and usually, as gastroenterologists, especially for patients who are above 40 or 50, we also request for a cardio clearance prior to doing the colonoscopy. So we also have to get clearance from your cardiologist. Okay, so I think we have some more questions here. What is your stand on taking colon cleansing juices or cleansing tea or high fiber capsules? Are these effective in preventing colon cancer?
There's these colon cleansing agents actually
Mm-hmm.
do not really, they don't prevent, having colon cancer. In fact, most of these colon cleansing products actually contain laxatives. For example, your teas, it's composed of senna, which is actually a laxative. So they induce a bowel movement. So you feel light, you feel sexy, but they would probably make you feel better, but in reality they really will not change your risk factors for developing colon cancer.
Okay, so thank you for clarifying that, Dr. Jello. So there's actually additional question on top of the doing the colonoscopy as an outpatient, but there's a follow-up question is, can we drive after a colonoscopy, driving the
Oh yeah,
car?
that's
Is it
that's
recommended?
actually that's actually a very very good question, because when you do your colonoscopy, medications are given,
Mm-hmm.
anesthetics are given, and you may actually feel groggy afterwards. So you're not advised, or you're not allowed to operate any type of machinery that would endanger your life or the life of others. So maybe operating your cell phone is okay, but not your car.
Okay, so I agree. So usually when patients go for colonoscopy, we don't usually allow them to drive cars after because, they might fall asleep on the way home. Okay, so there's a lot of questions, but most of the questions have already been answered. But yeah, just a few more, I guess. Is it safe to get vaccinated when you're undergoing chemotherapy from colon cancer? Vaccinated from
Uh,
COVID?
Vaccinated for COVID,
Yes,
when you're
for
having
colon cancer.
chemotherapy for colon cancer. Well, that has to be discussed with your oncologist. No, those are
Mm-hmm.
some of the things that have to be heavily discussed with your oncologist, because a different there it has to be very individualized. So
Mm-hmm.
patients who have cancer are immunosuppressed, so it has to be studied, and proper recommendation has to be given. So it's very individualized. We cannot really actually generalize, uh, but yeah.
Okay, so I agree with you. So it has to be individualized. Check with your doctor first because they know also what chemotherapy you're giving, and just to be sure. So another question is, if a person has diverticulosis, is it prone to developing colon cancer if you have diverticulosis?
Okay, maybe this person who asked that question has diverticulosis or knows somebody
Yes.
who has diverticulosis. Diverticulosis, for everybody's information, is an outpouching of your colon. So, para yang yung pader tapos yung pintura nag ano siya, nagbubble siya, no. It nag lumobo siya. So your colon, because it contracts regularly. So over time, you could have weakness of the wall of the colon, and then you can have a pouch, which is, nakauslit. And that's what you call diverticulosis. People have diverticulosis. Do not. It's not a risk factor for developing colon cancer,
Okay.
but you can have other conditions such as diverticulitis, which is inflammation of that particular blind pouch, and that could lead to other serious conditions as well.
Okay, so I think that ends our Q&A portion. Thank you very much for your extensive lecture and for answering all of the questions all
Thank you,
about colon
Susie.
cancer, Dr.
Thank you,
Jello
Dr. Susie,
Lozada.
for moderating the
Thank you.
questions.
Yeah, thank you. Actually, if I may ask Dr. Susie and Dr. Jello to stay just a little longer, this being Colorectal Cancer Awareness Month, it was so good to learn from both of you, actually. But we'd like to ask you for any parting messages that you would like to share to our Maxicare members who are here in attendance. Siguro we'll start with Doc Susie.
Okay, so first and foremost, again, thank you everyone for attending the webinar. I mean, the Dr. Jello Lozada's lecture regarding colon cancer. And, as they say, if you're already 45 and above, even if you don't have any symptoms, you're already a candidate for colon cancer. Even more, if you have a family history of colon cancer, then you have to do it earlier. And colon cancer is treatable, preventable, and beatable. So when in doubt, just go seek your consult with your gastroenterologist.
Thank you so much,
Thank
Dr.
you.
Susie. Dr. Jello, we'd like to hear from you once again.
So I pretty much actually, Dr. Susie has said it all. No? So if you do feel like you want to get a colonoscopy, or you think you're kind of shy, we have different types. We have different types of gastroenterologists at Makati Medical Center. There are female gastroenterologists like Dr. Susie. There are young gastroenterologists like ourselves. We have older, more senior gastroenterologists. So you just have to have yourself tested, especially if you're already at that age. Because as I tell my patients, this is for your future self. Your future self will thank you for it.
All right. Well, we thank you for this. Thank you so much, Dr. Jello and Dr. Suzette. That was very enlightening. To our attendees, thank you so much for participating in that wonderful Q&A. Such great engagement that we're seeing here in this event. To our Maxicare members, can we invite you all to please take a few moments later to answer a feedback form? And you can do that right after this event. Here is a link on the chat that's already being loaded right now for you. You can copy this link, or you can take a look at this QR code that we're flashing on your screens. You can capture that right now because your feedback would be most appreciated. Now, we are ready to announce the winners of our raffle draw. The winners were randomly selected by our staff. We'll have one winner who will receive a portable yoga mat as promised, another winner who will receive a J umbrella, and a winner who will get a mini clutch bag. Are you ready to find out who they are? The winners are the following. I'm trying to read that. Osang Cruz from Equicom Savings Bank. Thanks so much. Congratulations to you, Osang, for winning the portable yoga mat. That's a really great prize. Aaron Nugent will be getting this wonderful J umbrella, and we have Michael Leo Manjares of BPI. Congratulations to all of you. You still have chances, of course, in our future Maxicare Wellness Fridays event. To our winners, the Maxicare team will get in touch with you and claiming your prize. Congratulations once again. Now, before you guys really go, we still have two quick poll questions that we want to ask you. And that first poll question that we always like to ask you is, do you want to live your best life? This is something that you need to do, just like what Doc Jello and Doc Susie actually mentioned before. For you to be able to live your best life, you got to take care of yourself. So this was such a great discussion. It was an eye-opener. So your answers are absolutely positive to us. Yes, of course, at Oo, syempre. Of course, everyone, resounding event that you just attended today. We still have other topics that we can share with you. Which topics would you like to see in our next Wellness Fridays? And you can choose more than one so that we know what you would be most interested in. Yung skin sites, taking better care of the skin during this pandemic. What about building relationships amidst the pandemic? How to bounce back in life is also going to be a great topic. How to sleep better. Please sign me up for this event. What about, here we go, achieving healthy hair? These are wonderful topics that we can talk about. But we'd like to see what you guys want to know more about. Okay, so let us know. You can choose more than one out of those options. How to sleep better. Yes, a lot of people want to know more about that. But also, a lot of people are looking for skin sites, taking better care of the skin, lalo na summer. Even though we're just going to be indoors, we still have to really take care of our skin. Thanks so much, guys. If you enjoyed this experience, please do share on your social media using the hashtag Live Your Best Life and the hashtag Maxicare Wellness Fridays. And you can tag Maxicare also on Facebook. Alam nyo na, Maxicare Healthcare Corp. Their IG is at Maxicare Healthcare. And you should also look for, follow, comment, and like Maxicare Health and Wellness on their IG when sharing about your wonderful takeaways from this event. And you can also subscribe to their YouTube channel, and it's Maxicare Healthcare Corporation. Do you want to know more about Maxicare's products or share it with others? Please go to www.shop.maxicare.com.ph, or you can send a message through FB Messenger. It would be great if you could share more information about Maxicare and how to be a member, right? If you have questions about this webinar and, of course, all of our Maxicare Wellness Fridays events, you can email them at maxicarewebinar@maxicare.com.ph, and we're flashing that on your screen. See you guys at our next Maxicare Wellness Fridays, which will be on April 16th. Can you guys put that on your calendar already? April 16th at 5 p.m. as we talk about achieving better sleep. That's right, we listen. Achieving better sleep during the pandemic with Dr. Michael Alexia Sarte. The QR code for the registration is being flashed on your screens right now. So please make sure that you register early, capture this QR code. And also, just as an advance invitation, this you're gonna like. On April 30, matagal pa, pero mark it already at 5 p.m. April 30, 5 p.m. We will have a session on getting ready to rebound with the Bo Sanchez. Yes, Bo Sanchez. So that's April 30, 5 p.m. Getting ready to rebound. Thank you so much, guys. Now, just a special announcement, by the way, all Maxicare primary care centers will be open and operate as usual on March 29 to 31, that's Holy Monday to Holy Wednesday, and on April 1 to 2, Maundy Thursday and Good Friday. All PCCs are actually open except Ayala North Exchange Makati, Eaton Centris QC, and Abriza Mall Davao. So all PCCs are open except for these three that I just mentioned due to preventive maintenance activities. From April 3 to 4, Saturday and Sunday, all PCCs will operate as usual again. Now that ends our event for today. I just wanted to share with you that important information. Thank you so much for being with us here this afternoon. We hope that you enjoyed and you were able to take away meaningful information. Thanks again, everyone. I'm Patricia Bermudez-Hizon, and we all know that with Maxicare, we can all live our best life. Take care.